Hello, this is Carol Bullard with Joyful Health and Wellness. I do functional, integrative, holistic health, and I just want to come talk to you today. I am frustrated with traditional care. I just am. So, let me tell you, there are people in this world who go to their doctor and they get a pill for X problem, and when X problem isn't getting solved, they come to see me. And usually I ask them, what are your medications? What is your history? And then I talk a little bit about diet, their rest, their sleep, their exercise. And when they're telling me that they eat fried chicken, mashed potatoes, Oreo cookies, and then they wonder why their hemoglobin A1C is 7, and they tell me I'm just pre diabetic, but I'm on metformin. No, at a hemoglobin A1C of 7, you are diabetic. And then when I look at their magnesium and it's less than 2, and they're taking mag oxide, that is like me putting a flower pot water bucket on a huge fire. That's not going to work. So we have decisions to make about our health. You can choose to continue in the path of traditional medicine, going to get a pill, seeing your doctor every 6 months, gaining weight, nothing being done. Or you can come and see a functional provider like me, where we do a 30-minute consult, an hour consult, and we'll look at everything from your childhood history to what meds you are on, your history, what you've tried, what you haven't tried, what you want to accomplish. So there's just a few things, and I'm very frustrated today. You probably hear it in my voice, and I can't be too specific. But if you are on metformin, if you are on a protein pump inhibitor, acid reflux medicine, more than likely it's going to lower your magnesium. And magnesium does over 300 functions in your body. So it's frustrating when somebody has Medicare and you go to order a magnesium in traditional and you get a pop-up that says, review this diagnosis, Medicare will not cover for it. Do you know how frustrating that is? Such an important element is magnesium, doing 300 functions over your body. Don't you think that that should just be covered? And why does it cost $100 to get done? So let me just tell you, you can choose to keep doing what you're doing if you're not healthy, and you can keep listening to your traditional medicine doctor and not getting the labs that you need, not getting the diet and health coaching that you need. You can continue having your 15-minute visits where you might get one or two problems addressed and then nothing else. You might have pain, and maybe your doctor, because I heard somebody say yesterday, my doctor just told me to take Tylenol and walked out. Okay, but did they ask you why you're having your pain? What your electrolytes are? What your vitamin D is? Because those are all things that can, if your hormones are off balance, if your vitamin D is low, that can also cause joint pain. So why are these doctors not fixing these or looking for these causes? Because they don't have time. Because it's a run of the mill. 15 minutes in, 15 minutes out, move on to the next patient. So I really want you to consider coming to see a functional provider, whether you come see me or one of my other friends that practice in functional medicine, because those are things that are important that we look at. So if you are having sleep issues, I recommend magnesium glycinate. If you're having high blood pressure, heart issues, you need magnesium with a T, taurine, because that is more cardioprotective. If you are on gastric reflux medications, metformin, you need to have your vitamin D, your vitamin B12, and your magnesium. That needs to be checked frequently. You probably need replacement. So I just want to encourage you today to make sure you're eating a healthy diet, eat clean, fruits, vegetables, protein 100 grams a day, drinking your water 100 ounces a day, exercising 30 minutes a day. If we're over 40, we need to be doing weight resistant exercises. Making sure sleep. If you have obstructive sleep apnea, make sure you're using your CPAP. If you have sleep issues, of course, it can be your hormone problems. You need to get that checked. Your vitamin D can be low. Make sure that you're taking magnesium glycinate at night with L-theanine, or that you can take ashwagandha too. That is an adaptogen. I can't say big words, but that will help you sleep as well. And then making sure that you're managing your stress, getting that good sunlight, getting grounded, praying, meditating. And the verse in the Bible that was used when I was growing up, when preachers would preach against, oh, you shouldn't smoke, you shouldn't drink, and you shouldn't, they would always say, your body is a temple of God. Okay, I get it, but your body is a temple of God, and that includes what we put in our body, not just tobacco, not just alcohol, but also our food and our exercise and how we treat, because should be good stewards of our body, of our money, in anything that we do. So I really want you to think about these things. So Carol Buller, Joyful Health and Wellness, and I just encourage you to reach out to me for a consult. If I could change your life, if I gave you 30 minutes free time with me for a consult, and in 30 minutes you tell me what your problems are, and I could give you 3 things that would change you, would you invest that 30 minutes for free? That's what I want you to ask yourself, because that's what I'm willing to do for you, because I believe in what I do, and I believe that I can really help people and change people's lives. Y'all have a good day. Thank you.